Hi, good day to everyone. I would like to begin with thanking the judges for giving me this opportunity to present. My name is Benzil Binu, and I'm a final year medical student studying in Gulf Medical University, Ajman. And today I'll be presenting our research titled Understanding Constipation Among the Elderly Determinants and Relevance to Healthy Aging in a Tertiary Care Setting in Ajman, UAE. So, our study focuses on an area that is often overlooked but has significant clinical and public health importance, especially in the aging population. So, to give you a quick roadmap of this presentation, we'll start with a brief introduction followed by the objectives of the study. And then I'll walk you through the materials and methods. And then we'll spend some time talking about the results. After that, we'll move into detailed discussion, followed by the recommendation, and finally, the relevance of our findings to healthy aging. To begin with, constipation is one of the most common gastrointestinal disorders, especially among the elderly. Clinically, it is characterized by symptoms such as hard stools, excessive straining, reduced bowel frequency, and a sensation of incomplete evacuation. But more importantly, it is not just a simple symptom. It reflects a functional disturbance in bowel motility and defecation dynamics, and in many cases, it can become chronic. What makes it even more relevant is that its prevalence increases significantly with age, making it a major geriatric concern. Now, when we look at the causes, constipation in the elderly is multifactorial. There are physiological changes like reduced gastrointestinal motility, but also external factors like polypharmacy, reduced mobility, and poor dietary intake that can play a major role. And importantly, it's strongly associated with loss of functional independence and reduced quality of life. Despite all this, it is often under-recognized in clinical practice and frequently treated as a secondary symptom rather than a primary condition. So, this gap in recognition is what led us to approach constipation as an independent clinical entity. Clinically, constipation presents with a wide range of symptoms, from bloating and abdominal pain to difficulty in defecation and decreased frequency. If left unmanaged, especially in the elderly, it can lead to serious complications such as hemorrhoids, fecal impaction, rectal prolapse, and even bowel perforation. So clearly, this is not a benign condition. That brings us to our central research question. What are the socio-demographic determinants of constipation in the UAE elderly population? Based on this, our main objective was to examine and characterize the socio-demographic factors associated with constipation among elderly individuals aged 60 years and above. We specifically looked at variables such as age, gender, nationality, marital status, and BMI. The broader goal was not just identification, but also to support early detection, risk stratification, and preventive geriatric care, ultimately contributing to healthy aging. Now, moving on to the methodology, this was a record based case control study conducted in the Tumbe University Hospital, Ajman. We included elderly patients aged 60 years and above. Cases were patients with a documented diagnosis of constipation, and controls were patients without constipation. Ethical approval was obtained from the Institutional Review Board within the university as well as the university hospital. The total sample size was 241 patients with 80 cases and 161 controls, maintaining a 1:2 ratio. We used convenient sampling, excluding the incomplete records. For analysis, data was processed using SPSS version 30. We used descriptive statistics, chi-square test, and logistic regression analysis. A p-value of less than or equal to 0.05 was considered statistically significant. Now, moving to the most important part of the presentation, which is the result section, let's begin with looking at the table number one, which shows the distribution of socio-demographic factors between patients with and without constipation. I'll break this down step by step. Starting with the age distribution, the 60 to 69 age group formed the largest proportion of cases, about 78.8% compared to 59.1% in controls. Interestingly, the 70 to 79 age group had a higher proportion in controls, suggesting a lower association with constipation. This indicates that the relationship between age and constipation is not linear. Now, looking at gender, there is a very clear pattern. 71.3% of the cases were males compared to only 37.4% in controls. This shows a strong association between male gender and constipation, which was statistically significant. For marital status, nationality, and BMI, we did not observe any statistically significant differences between cases and controls. So overall, from the table number one, age and gender stands out as the key differentiating factor. Now moving to table number two, which is a logistic regression analysis. This was used to help us understand which factors are independent predictors after adjusting for confounders. The most important finding here is that the male gender emerged as a strong independent predictor with an adjusted odds ratio of 4.3, meaning males were over 4 times more likely to have constipation compared to females. Now, looking at age, the 70 to 79 age group actually showed a significantly lower risk with an adjusted odds ratio of 0.25, whereas the greater than or equal to 80 group did not show a significant difference. So, again, this supports the idea of a non linear age relationship. And importantly, other factors like marital status, nationality, and BMI were not significant predictors. Now, moving into the discussion, let's start with talking about gender. Our study found a strong male predominance, which is actually contrary to many community based studies that report higher prevalence in females. So, why is this happening? In a hospital based population, men often present with higher comorbidity burden like hypertension and diabetes. As a result, they tend to use more medications which have constipating effects. Another interesting thing which we found by looking through the literature was that men tend to have a delayed healthcare seeking behavior. So, this creates a different clinical profile compared to community studies. This highlights the need for targeted screening in elderly men, especially in tertiary care settings. Now, coming to age, we observed a non-linear relationship where the 70 to 79 group had lower odds. This suggests that constipation is not just about aging itself, but how aging interacts with multiple factors. Physiologically, aging is associated with reduced gut motility, slower colonic transit time, and pelvic floor muscle weakness. Another key factor here is sarcopenia, which is the loss of muscle mass and strength, which plays a major role in bowel movement and defecation. So, constipation can actually reflect early functional decline and not just aging alone. Of course, our study has some limitations. Being a case control study, we cannot establish causation. Data was based on medical records, which may underreport mild symptoms. We did not assess factors like diet, hydration, or physical activity. And since it's a hospital based, generalizability is limited. But despite this, the study provides important insights into a largely under researched area in the UAE. Based on our findings, we suggest several key recommendations. First, targeted screening, especially for elderly men. Second, early preventive strategy, including high fiber diet, adequate hydration, and regular physical activity. Third is a routine medication review to identify drugs that may worsen constipation. And finally, a future research direction should include prospective and community based studies with more detailed lifestyle assessment. Now, finally, let's look at why this study matters in the bigger picture of healthy aging. Constipation is not just a gastrointestinal issue, it can actually act as an early marker of functional decline, reflecting reduced mobility, muscle weakness, and overall frailty. If not addressed, it directly affects independence, daily functioning, and quality of life. But the important part here is that constipation is modifiable. So it gives us a valuable entry point for early interventions, whether through nutrition, physical activity, or medication optimization. So instead of treating it as a minor symptom, we should integrate it into a holistic geriatric care model. So these are the references which we used for making the presentation. And thanks very much